The next topic I wanted to discuss is something that I think is lesser known about the effects on the body of sleep apnea. So sleep apnea in general, what we all know is the cardiovascular effects. So hypertension or high blood pressure, the risk increasing of stroke and heart attack, also atrial fibrillation, which is another cardiac condition. Those are all effects of the pressure in the body building up when the person is basically not able to breathe. It's almost the same thing as holding your breath. Basically, the breath cannot come in or out, so the pressure inside the thoracic cavity builds up, and then it has effects on the heart and the cardiovascular system. So sometimes the very first sign that somebody has sleep apnea is that they will have a heart attack or stroke. Then in retrospect, it is found out that they have sleep apnea. If they are fortunate to survive these major events, then they can start treating the sleep apnea. However, there's many other health effects or conditions that are caused by what we call fragmented sleep. So if you are having partial obstructions to airflow, it can cause the body to wake up from the sleep stage. Every time you wake up in the middle of the night, it could be 15 times, 20 times, 30 times. That is interfering with the proper flow of the sleep stages. When this occurs, you may or may not fully wake up from your sleep, so you may not be aware that you're waking up many times, but those kinds of effects have consequences for during the day, which means people will experience sleepiness and other health effects such as are listed on the screen. Some very interesting ones are insomnia and attention deficit disorder, especially seen in children who are not sleeping well, asthma, also difficulty in losing weight, erectile dysfunction. There's many, the list goes on. It's amazing to see how many things in general are affected or could be affected by sleep apnea. So if you have these conditions, the more conditions that you can list off that you have, then there's an increased chance that you might have sleep apnea as an underlying cause. However, some of these conditions can already be pre-existing. So you might have diabetes already, and then if you have sleep apnea on top of that, it might be more difficult to control your blood sugars. So any way you look at it, if you find out you have sleep apnea and you treat that, you won't just extend your life span potentially by 10 years, but many other things that are happening that you might be taking medications for could improve. We're not promising that they will improve, but even things like acid reflux, sometimes you're taking medication for that, and when you start treating sleep apnea, you notice all of a sudden that there's less acid reflux. So all those things are bonus for general living and health conditions, and improving the quality of life, especially on the sleepiness scale. Having less sleepiness if you're treating your sleep apnea, not waking up, you actually get to enjoy your life much more. You have more energy to do things, more energy to exercise, to go on vacation, spend time with your friends, or cook meals from scratch. So I think in any way you look at it, treating sleep apnea is always going to be a winning situation.